Hi everybody. Today I want to talk about how you can track our progress from a healthcare perspective through the COVID-19 situation. Now, the graph I'm showing here, this is from Tuesday night. Dr. Fauci, Dr. Birx presented this in number of deaths per day. So this is from the University of Washington Institute for Health Metrics and Evaluation. And we saw this scary number of 2,214 deaths on April 15th. That would be our peak. And if we look down here, where the envelope, this gray area, like we call it an envelope. So you have a line graph, and an envelope is sort of a range or a tolerance that applies to the numbers. And right at the beginning of the envelope, the dotted line is actually solid. That's real data, okay? So they're inputting the real data, and then the dotted line is the model data, what we expect to happen. And this is what it looked like on, I believe, the 30th. So let's get rid of that. And let's take a look at, okay, so here's where we are now. This is today the 2nd, so 3 days later. Back then, this is where the real data ended. And it looks like we had a large number of added deaths on the 31st. So it jumped from 520 to 877. So we had a large uptick there. And then from March 31, from 877 to 900. And I'm assuming because of this was unexpected. If you look back at the previous graph, that was not a big jump on that day. So let's look at it. So see how the model came in sloping. The end result, we're now looking at 2,644 deaths, and it's on April 16th, not April 15th. So because of that, whatever number we're hitting on the 15th, well, it's till 2,637 on the 15th and 2,644. So higher number, peaking a day later. And that's updating the model based on reality. Now, you could drive yourself crazy looking at this every day and thinking, but again, this is a model, okay? Everything that's happening in here is a model, so it's helping us to anticipate what's going to come. But you can refer to this at covid19.healthdata.org projections, or you go to the IHME webpage and look for COVID-19 projections. And this, by the way, is for all the United States, and we can look at by state if we want to. So let's look at this up here. This is the resources needed. So throughout the entire United States, before we do this, okay, before we get into any more graphs, let's look at the FAQs, because there's some useful information here. Tells us where their assumptions come from. So under this question, does the model show the effect of social distancing and other measures? I'll try not to read this whole paragraph, but it says that here in the United States, we've implemented measures at the first administrative level. That's a term I'm not familiar with. In parentheses, it says in the U.S., this generally means the state level. So implied in that, there's probably some more that the federal government can do. I said in a previous video that the federal government couldn't do. I think I was more thinking about if the federal government goes against the governors. You hear the word constitutional crisis. That would be a real one. So anyway, so it assumes we're putting measures at the first administrative level. And how about this? It assumes we're continuing this social distancing through the end of May. Not good. Not happy to see end of May. Our plan right now is end of April. But again, this is a model. So if we outperform the model, end of April could be realistic. But right now, based on what they're projecting, they're saying we need to do this till the end of May. And they use close social distancing. This is an interesting, using the New Zealand government alert system level 4. and then assuming that we've instituted that pretty much nationwide. So if we look at this from New Zealand and we zoom in, so they have 4 levels. Okay, disease contained. If we look at level 4, looks very familiar. Stay at home, schools closed, business except essential services closed. So that's something you can look at if you like. So that's informing the model. Those are some of the assumptions they used. Will we need social distancing until there is a vaccine? And the quick answer is yes. This is the model. Well, the model is assuming no vaccine. Okay, so the only way of preventing the spread is through social distancing. So that's what they assumed in the model. But by the end of the first wave, okay, so they're talking about a second wave, right? But anyway, by the end of the first wave, an estimated 97% of the population will still be susceptible to the disease. So, on one hand, we say it's good if a small number get infected, but on the other hand, that means we're more susceptible to a second wave. So then measures, we will need measures to avoid a second wave. And we've heard some talk about that. What will we do when we go back to work? So that might, some of the social distancing. And here's an interesting, continue social distancing or replace it with nationwide efforts such as mass screening, okay, that's testing, contact tracing, that means we test you. If you come up positive, we want to know where you've been over the last week or two. Have you been to restaurants, bars? And, then they would probably publicize that and say, anyone who's been in these places on these dates need to be tested. And then a selective quarantine. So you test positive, they try to track where you've been, notify other people who've been in those places, and test them, and quarantine everyone who tests positive. So that's what we could do if we had more testing, which we could have in place. If no vaccine, then we could possibly have that in place by the second wave. So they're talking about peak resource use in the hospitals, so that's all pretty self-explanatory. So how many deaths? As of March 25th, they estimated over the next 4 months, 81,000 people will die. Okay, so the other model, the one built on the flatten the curve visual, had, if we did all the social distancing, a 100 to 220 or whatever it was range. So this is below that. This is 81,000. And 4 months. Okay, well, we're only doing 1 more month so far. That's our plan. You've already said that for the virus to go away is going to take an extra month, so that's 2. Maybe assume we've been doing this for, where's this 4 months coming from? Well, that's where Fauci was talking about the deaths will continue, and I think I sort of recall him even saying into July. So even after the virus is gone, it's spread. So if you look at the virus spread graph, it could be gone. People are still sick. People are still in hospitals and dying all the way, for a couple of months after that. Nothing by age group. So there are different states. Talks about why is it to the end of July. Okay. Why are these estimates different than those by other organizations? So they say their models formed by the shape that other outbreaks are taking in terms of deaths around the world and across the U.S. So they're taking what they're seeing in other countries plus what they're seeing now, and that's informing the model, and then the model is informing us. So other models may use other approaches, such as assuming a population where everyone was equally likely to interact with everyone else, and model different scenarios, such as the absence of or different levels of social distancing. These are useful for motivating action to prevent worst case scenarios, while our model is designed to address the planning needs of hospitals and administrators. Okay, so the first model, the flatten the curve model, that's to help us understand the impact of the social distancing. And one of the criticisms you may be hearing from people on models is they're not taking into account the different population densities throughout the United States. Well, this one does. You will see that. And they mention that other ones may assume a particular proximity of people and things like that, where in their model they do not. When we start looking at an individual state, you're going to see a big difference. Okay, and the last question, where do they get the data? Local governments and et cetera, et cetera. Okay, so we've looked at the United States. Interesting, 262,000 beds needed. That's a shortage of 87,000 beds, if the model is true, to the extent that it's accurate. 39,000 ICU beds in the country, and that would be, so that's about double what we have. And then total ventilators needed, 31,782 ventilators needed across the entire United States throughout the outbreak. Now, they do not know how many ventilators we have. So that's the total. So we need 32,000. You can subtract off what we already have, which they don't know. So it's less than that. And that's interesting because you probably heard of the sort of pulling between Andrew Cuomo. He wanted 30,000 more ventilators from the federal government. He didn't get what he wanted. He made some emotional statements about you tell who, whatever. So according to this model, they don't need 30,000 in New York. Now, we can actually drill down and look at New York specifically, okay? So, and we can show these numbers on the graph. This is showing the number of ventilators needed, okay? Now, again, there's an envelope here. So the 31,782 falls at the peak, but it goes all the way up to 55 in a worst case scenario based on the tolerance and accuracy here. We can look at number of ICU beds, so all beds. So many people are going to, of all the people infected, a certain percentage will arrive at the hospital, and we need beds. For those that are determined sick enough to need a bed, we need beds for all those. Then a certain percentage of those go to intensive care, and a certain percentage of those require ventilators. Now, I guess there's intensive care measures beyond ventilators because the need for intensive care beds is a little bit higher than the need for ventilators. So, okay, I'm not a medical professional, so I don't know. And okay, so this is just total deaths where we get to that 80. Actually, it looks like it's saying 93,000. It's actually saying 93,000 out to July. So we're thereabouts. So maybe that FAQ has not been updated, and based on real data, they've updated this. I'm speculating, but that 82 is now up to 93. So we're in that 100,000 range between both models. So let's look at New York. That's our hottest hotspot. So according to these guys, New York's total need for ventilators is 9,427, not 30,000. With a maximum, if you assume all the built-in tolerance, of 13,000. And I'm a little surprised. New York State only has 718 ICU beds. And so I live in Pennsylvania, less populated state. Pennsylvania has 1,043. Seems like New York State's pretty light on the ICU beds. California, so you can do this, okay? You can. I'm just sort of showing you the different ways you can look at it. California has nearly 2,000 ICU beds. So, yeah, you can always wonder if there's an error, something not accounted for properly in this model. But that just surprises me that they only have 718 ICU beds. But again, we see 9,000 to 13,000 ventilators needed, not 30. And again, the ICU beds could go up as high as 16. Of course, all beds. And you see the line here? So this is the, well, that's actually ICU beds. Okay, that's number available. So the line down here is showing you how many ICU beds they have available, and this is what they need. So the delta here is, well, it's the delta. That's what they need. So total beds, they have 13,000. They could need as many as 76,000 in the center, and it gets even worse from there. So now we see why efforts we see in place to build more ventilators, factories building ventilators, and National Guard, Army Corps of Engineers, hospitals themselves, building more ICU capacity. So they're not just working blind and saying, we need to just build as much of this stuff and hope for the best. They kind of have a number to shoot for. So this is informing. Again, it's a model. It's not precise. It could be worse. It could be better. But it's informing the decision making and driving the process. So that's what we have here. And deaths per day in New York, you can do this by state as well. So here we are in New York, hits 855. Now, again, some of the criticism has been that these models don't account for different population density. This one does. Okay, if you want to look at West Virginia, which was the last state to be infected, wow, they only have 196 ICU beds, but they only need 177 ventilators. So in terms of total beds, they have more than they will need by the model. Okay, more rural state, people more spread out. It was late to get infected. They had the measures in place even before the infections. So ICU beds, they could exceed the needed ICU beds, and ventilators needed. Okay, so we don't know how many ventilators they have, but they only need 177 according to the model. So Pennsylvania, we can do the same thing. According to this chart, Pennsylvania has enough hospital beds to treat everyone that will need a bed. We fall a little short on ICU beds, so we'd have to create some ICU beds, temporary in other parts of the hospital. I understand they're even considering some other facilities near UPMCs. There's several hospitals right in the campus of University of Pittsburgh, so they have access to a lot of buildings and things. So we're really short 87 beds in ICU and a total ventilator need of 900. Okay, contrast that, 10 times more ventilators are anticipated to be needed in New York. Now also, this is Pennsylvania. So I live in Western Pennsylvania, and we already know the eastern part of the state, which is very close to New York and New Jersey, the hot spots, Philadelphia and north of Philly, that's where the cases are going to be concentrated. So those of us in the western part of the state are probably in good shape. Can they move people? I don't know. But so you can take this and look at your state. So for me, this gives me a better feeling that the data is accurate because they have accounted for the different demographics in the different states and things like that. Now, I would caution anyone against looking at this data and saying, I don't have to worry. Okay, I'm in a part of the country that the virus isn't low numbers. I am young. My family is young, so I don't have to worry. And I caution against that because if you go back to the serenity prayer and you ask yourself, what can I do? I mean, I think some people are very upset, and rightly so, about the economy, how they've been hurt badly by the economic impact, and they think that we're overreacting with this distancing. Truth is, you can't change it. You want to try and change it? Complain. Complain to your local representatives, your state senators, your governor, your Congress people, your representatives, and start petitions. Ask them, say, we cannot ignore the economy. We think that we can get our economy going again sooner, maybe by region. pressure them. That's how our system works. You push but you yourself follow the social distancing guidelines. And why do I say that? What do you accomplish by not? Very, very little. If you're not working because of this, you don't have that option, right? You can't force them to take you back to work. You can't force restaurants to open. You can't force schools to open. So there's little you can do to affect change by just ignoring what's being asked of you. So the best thing, the most productive thing, even if you don't like it, is just do it. Because if the model where we don't do social distancing is correct, then we get into apocalypse and there's no backing up. We can't go, whoops, bad call, let's back up and do this again. I mean, this is real life, not a video game. You can't just respawn and try again. So, we need to keep that in mind and, do our part regardless of how we might feel about it. The other thing, I choose to look at this as, it's like an alien invasion. It literally is an alien invasion. There's an alien species that comes into our bodies and starts attacking our cells and replicating. And outside, it's trying to replicate itself by going from host to host to host. And this is similar to the influenza, right? But we assume influenza is not a bad thing. But we take for granted with influenza that we have vaccines, and whether you choose to vaccinate or not, 40% of people do, or 40 to 60% of the people do. So vaccines do a lot to eliminate the need for any social distancing, to control the spread of that virus. The other thing that we have with influenza is we have antivirals. So high-risk people that end up in the hospital that need critical care, we can do more than just keep them breathing or what. We can actually give them, similar to an antibiotic, but an antiviral that will help their body defeat this virus. Now they're doing experimentation with antibodies from blood plasma and things like all good stuff. So, but it's an alien invasion and we need to stop the spread. So whether you're highly susceptible or not, we need this thing to go away if we're ever going to go back to work. If we're ever going to get our economy, we need to get this thing under control. And by being in proximity to other people, we just keep it alive. We give it more places to go, more ways for it to spread. They're now telling us that it will live a long time in a freezer. If you have an infected grocery store worker and they load a freezer and you bring that food home, you're bringing the virus home with you. It could be on produce. We had one store that trashed $30,000 worth of produce. So that's not what we want. I mean, if you think about it, even if you're not worried about dying from the disease, do we really want to live in a world where we're bringing viruses home from the grocery store? I mean, this thing can just permeate our whole society, in every person, on every surface, on public transportation. I mean, I don't want to live like that. So that's how we have to think about it, is we need this thing to stop spreading. We need to reduce it. We don't want this foreign alien invasion into our bodies and into every aspect of our culture. I mean, we're likely to go back to work after the first wave wearing masks and gloves and, hand sanitizers and practicing social distancing. I mean, it's weird. I was at the grocery store a bit today and they're making announcements. At Christmas time, you hear all these Christmassy, we're going to do this special thing and we're going to have this. All I heard were announcements about the virus and the measures they're taking. I mean, that's our world. I mean, it's changed, I believe, forever. But to me, that says we need to do everything possible to get this under control. So have a look at it and, be informed. So this data can help you to be informed. If you're in fear for the well-being of your family, your grandparents, whatever, and depending on where you live, you can look at this and it can give you a certain sense of calm, a certain sense of assurance. Okay, we're not in a hot spot, so that's a good thing. But don't take that to the next level and say, well, we don't have to care. We don't have to worry about it. It's not even a problem here because, look, the way we're living now, that's the only thing that's keeping the hotspot, people in the hotspot, from spreading it all over the country. So we really do have to get this thing under control. And that's what it's all about. So hope that helps. Log on there, check it out, and be blessed.